طبعا the title of the lecture is portable X-ray in NICU, in the intensive care unit of the neonate and pediatric individual. The aim of the lecture is to highlight what do we need to know as an X-ray technologist from the quality control and ethical point of view. So the outline of the lecture, I will go through the objectives, the aim of the presentation, then brief introduction. Thereafter, I will go through highlighting some of the important issues in regard to the quality control and ethical responsibilities as a technician. Then finally, we'll conclude with a take-home message. The primary purpose of the lecture is to highlight our current practice in the NICU, improve the quality of the radiograph, and sustain this improvement over the time without compromising the child care or safety, as well as reducing the need of repeating radiograph, which is usually associated with increased radiation exposure. It's an important note to highlight is that what I'm going to go through is discussing how we could improve our practice from the quality control and patient safety, and I'm not aiming to criticize any individual. So I hope that it's clear for everybody that this is meant to improve our practice, not criticizing a person in particular. As you know, conventional radiograph is a great and useful tool in the neonatal intensive care. It is one of the most frequently requested examination in these unit, and it's considered as the cornerstone modality of imaging throughout the other modalities, although ultrasound now play another important part in the evaluation of these individuals. It's required to formulate an accurate diagnosis from obtaining these conventional X-rays as to discover the neonatal disease, as well as to monitor the progression of the disease process itself. It is also requested to assess and confirm the appropriate placement of certain lines, catheter, tubes, such as endotracheal tube, nasogastric tube, as well as the umbilical catheters. The number of X-rays taken during the hospitalization of the neonate is said to be related directly to the extent of the neonatal disease or prematurity. And therefore, you might see some of the neonates with more than 100 X-ray or exposure taken during their admission periods. This is highlight the importance of the radiation exposure during this period. And as you know, radiation exposure is having a high risk of effect on this age group as compared to the adult. And the radiation exposure might even affect the end results of the disease process itself, and it can exaggerate the disease process. High quality radiograph are important for ensuring an accurate diagnosis, assessment, and minimizing the radiation exposure. The radiographic quality is essential step in providing accurate diagnosis, and this is the reason I'm emphasizing on the importance of the quality of the images, as poor quality radiograph may lead to either repeating the X-ray or the radiograph, or even requesting another modality for evaluating a misinterpreted or misreaded poor quality image. What are the factors that could affect a poor quality image? The poor exposure, motion artifacts, or improper positioning of the patient. Patient is rotated, tilted, or moving during the exam. Also, what degrade the quality of the image is the presence of external objects, whether it is in the incubator or over the neonatal body, such as wires or objects related to chest leads or others. Examples for this is this image, which was taken for a child who was admitted to the NICU because of the cough and wheezing. The X-ray, if you look at the X-ray, you could see the haziness of both lungs, ill definition of the outline of the heart, as well as the bony thoracic cage. The initial interpretation or the initial diagnosis was, does this child having airway disease with a pneumonia? However, a repeated X-ray after 2 minutes showed total normal appearance of the lungs and mediastinal contour, therefore indicating the improper exposure and inspiratory phase. How we could say that this is a good inspiratory or not good? By counting the posterior ribs. If you see, these are the posterior ribs. One should get 8 or 9 posterior ribs above the dome or the apex of the diaphragm. Here we could see only 7 ribs are seen at the level of the dome of the diaphragm, while here we could see with improved exposure and inspiratory exposure, the lung fields became more clear. So it is always important to try to get the exposure during the inspiratory phase. One would ask me, how could I know that this is inspiratory in this premature? Always you could see the premature babies are crying. So when you want to expose, try to get the exposure in between the cries. So during crying, it will be an expiratory phase. So, and in between the two cries, you get you could obtain a good inspiratory film. Another effect of the poor inspiratory film is usually the abnormal configuration of the trachea, which we receive a lot of calls from the clinician that there is deviation of the trachea or there is curving of the trachea, which could suggest presence of mediastinal mass or lesion causing this displacement or abnormal buckling. One should be careful in getting the good inspiratory film, because this is exaggerated with the poor inspiration. You could see the buckling of the outline of the trachea. So this is another important example for obtaining a good inspiration. In regard to the wires and objects, you could see the unacceptable chest radiograph with multiple leads wire projecting over the lungs, therefore making evaluation of the lung unpleasant, and the repeat good inspiratory with removal of the objects that are projected over the thoracic cage, giving a clear outline of the lungs with a clear outline of the both thoracic cage. If we come to this example, another example of multiple objects are projecting over the lung fields, and they repeat with after removing, showing that the lungs showing an abnormal lucencies within, indicating that there is an underlying lung pathology within the lung itself. Another example, which is an important for the tech to observe, is the tilt and rotation of the child. And I will show you the effect of this tilt or rotation. If we look at the chest x-ray here, we could see this line that project over the right hemithorax. This line was thought by a junior radiologist as a pneumothorax because of the increased blackening or lucency in the peripheral aspect of the lung. And this was actually a skin fold related to the child tilt. How we could assess child tilt or rotation by looking at the midline. Midline usually represented by the mid aspect of the vertebral body, and evaluating the clavicles, we should see symmetrical outline of the clavicle, which is not present here. Not only that, if we look at the ribs, we could see that the anterior ribs here are seen in significant length, while on the right side it is effaced because of the rotation. So this is a child with remarkable rotation, leading to presence of a skin fold that resemble a pathology, pneumothorax. We repeated the chest X-ray, and we could see that the skin fold is out of the field of the child. So the right hemithorax is clear within the repeated chest X-ray. So this is the importance of highlighting uh, some of the factors that could degrade the quality of the image and necessitate a repetition, and therefore increased exposure factor. So one should take care of performing the X-ray. So the technologist must always focus and ensure the best quality performance of the X-ray, the radiation protection by the collimation, applying the collimation for the requested area, whether it is the chest or abdomen. Also, applying the ethical standard of practice and patient safety, which could ensure the diagnostic accuracy, the capability of obtaining images with high quality to evaluate or detect changes that could clarify presence of respiratory, cardiac, or GI problem within the images obtained, reduce the radiation exposure by minimizing the need of repeating X-ray, and minimizing the need to move the child. You know that when you repeat, you need to move the child, inserting the cassette inside beneath the child, and this movement can increase the possibility of other complication such as intracranial hemorrhage, internal hemorrhage within the chest or abdomen. So these are reported cases by the increased movement of these fragile neonates. Also, it is by applying the ethical standard, we could ensure the clear verification of the placement of the lines and tube, and monitor these the location of these lines. At the end, the by applying this, the tech will preserve the safety and dignity of the neonate that he's dealing with. What are the international recommended fields for typical chest or abdominal X-ray? It is as highlighted in this slide. For the chest, one should include the base of the neck up to the costophrenic angles with without opening the fields to visualize the outside the image, and which is an important issue. Also in the abdomen, from the base of the lung down to the what we call it ischiopubik rami, the lower aspect of the ischiopubik rami, without
تمام
opening the
دكتور.
field to increase the exposure to the child. If we look at an example for improper exposure and positioning,
عفوا دكتور،
we could see this child.
تواجه مشكلة في العرض عندك دكتور؟ في مشكلة في الإنترنت عندك أو شيء؟
عفوا ما سمعت.
عفوا، في مشكلة عندك في الإنترنت أو شيء، أو الباندويث عندك، أو الإنترنت
أنا
شوية في ضعف عندك؟
أنا بالمكتب ما عندي النت شغالة، ما بعرف. ما واضحة عندكم الايمجز؟
لأن طالعة الشاشة خضراء يعني، فما أدري هل هو.
مو طالعة، سألتكم الشاشة طالعة ولا ما؟
لا، الشاشة كانت طالعة الآن، الحين راحت. ما أدري لو تحاول مرة ثانية، لأن من شوي ترى بدأت يعني.
طيب
الآن تمام. أي.
اوكي. طيب اي سلايد هذا شفتوه سلايد؟
أيوة.
طيب. Now another example of the presence of proper imaging in regard to the chest and abdomen, for example. This is a child who was requested for chest and abdomen. Uh, Unfortunately, the tech who did the exam, he put the shielding for the gonadal, but as you could see here, the shielding has covered part of the lower abdomen and pelvis, and therefore obliterating even the outline of the central venous catheters. Therefore, we couldn't evaluate the proper outline of the vascular structures, the vascular catheters, as well as the part of the pelvic region and lower abdomen. And the repeat showed clearly the outline of these vascular structures and the pelvic region. So one should be careful when he applying even the gonadal shielding, as not to obliterate the part of the image or the part of the lines that are needed in the X-ray. This is to show you the importance when the image is requested for the chest, and you could collimate the X-ray, the field of view for the chest. You could see the outline of the changes within the lung, and even through the cardiac silhouette or the cardiac shadow clearly as compared to the X-ray, which include the chest and abdomen together. So it's always important to confine to the requested area, chest or abdomen, or both chest and abdomen in certain disease entity or related entity. So the quality control maintain the consistent of image quality and equipment performance. Therefore, it ensure reliable and safe imaging for delicate babies. Also, it prevent overexposure by minimizing the repeats and optimizing the radiation dose for these babies. Also, it is always concerned with the maintaining of the equipment performance, which is one of the important issues that the tech should be taking care during his work in performing portable conventional x-rays. Now, what are the steps of responsibility in taking in consideration the quality control? Uh, these could be divided into before, during, and after performing the exam. Before, before one should be careful in verifying the patient ID by looking at the bracelet in the leg or label in the incubator. Check the X-ray machine before performing the exposure for optimizing the exposure factor setting. Also, inspect the detector or the plate that is usually placed under the child or the neonate for its cleanliness and correct labeling. Also, the use for lead markers and ID of the technologist if it is applied in our hospital, and ensure incubator safety before performing the exam. During the exam, uh, you should apply the lowest possible exposure, which we call it ALARA, that refer to as low as reasonably achievable exposure that could provide adequate information on the X-ray image. Use collimation tightly to the area of request or region of request, whether it's chest or abdomen. Keep the lid shielding in a proper position, not to cover requested areas. Ensure incubator doors are closed and sealed for patient or neonatal safety, and record the reason if repeat is indicated, why repeat has been done for performing the x-ray. After the exam, the tech is responsible to review the image for the clarity and diagnostic capabilities, as well as verifying the image labeling, and transfer these images into the PACS system. Uh, don't forget the importance of cleaning the detector by approved disinfectant material, as well as report equipment or artifact issue immediately to the supervisor. Is the image still or again?
راحت الحين الشاشة كله شغلة بس.
طيب. I will re now.
ممتاز الله يعطيك العافية.
تمام. So these are the after exam requirement. Among the ethical responsibility of the tech is to respect neonatal fragility. He is very fragile, and therefore it should be handled with care. As I mentioned, too much movement can lead to complications such as intracranial bleeding, which are the very common complication occurring in the neonatal individual during uh, uh, several movements. Also, among the ethical responsibility to maintain privacy and confidentiality, communicate with the NICU staff and even parents if they are available around or present, and don't forget to avoid unnecessarily repeat exposures or X-rays. Among the responsibility for the radiation protection, as I mentioned, one should apply the radiation dose as low as possible for getting adequate images, diagnostic images. Use individual leads shielding in a proper positioning, maintain safe distance between the staff and the exposure, and keep the dosimetry badges and the radiation logs updated always. One of the important issues that we usually forget is the infectious control. The importance of the use of disinfectant material to clean the unit, detectors, using certain gloves and aprons for minimizing the possible infection spread. Also, the use of the practice of hand hygiene and gloves, as I mentioned in the during the performance of the procedure. So, in conclusion, conventional radiograph is an important modality that is used in the neonatal units, frequently requested. Therefore, images should be obtained with the responsibility of the tech to assure getting minimized exposure to the neonate, as well as minimize movement to assure patient safety, as well in getting an images that is limited to the area of interest to improve the quality of the findings within these images. I hope by this quick review I have highlighted the importance of the quality control responsibilities of the technologist in obtaining the conventional radiographs in the neonatal units, and the importance of minimizing repeating X-rays and therefore minimizing exposure to the neonate. Thank you very much.